Hi, now let's discuss about understanding the role of engineering in medical diagnosis, treatment, monitoring, and rehabilitation. Also, we want to start talking about the definition of biomedical engineering or medical engineering. So, engineering first, we need to know or discuss about what is engineering. So from Merriam-Webster's dictionary, engineering has been first used in 1697. Engineering can be defined as the application of science and mathematics by which the property of matter and sources of the energy in nature are made useful to human being. Or it can be defined as the design and manufacture of complex products. So one can say engineering transfers scientific knowledge into useful products, devices, and methods. Then we have to think about what are the differences between science and engineering. And also we want to define biomedical engineering upon this definition of engineering. So one way we can think of engineering is the pursuit of knowledge would be considered as a science, while the application of the obtained knowledge is an engineering. And you can think of as many different kinds or viewpoints looking at what are the differences between science and engineering. However, nowadays, the engineering and science are kind of blurred. The boundaries are blurred and it's becoming more merging together. Now we are talking about biomedical engineering, which is an engineering that is applied to biology and medicine. And the goal is ultimately to improve human health and well-being. So we can say BME or biomedical engineering as the application of engineering principles and design concepts to biology and medicine for healthcare purposes. For example, diagnosis or therapies. Now, let's think about in our daily life, can we think of any examples of biomedical engineering and their roles? So this is an open question. What kind of technology, products, or procedures you can think of as a biomedical engineering? So here I raise up a few examples. For example, X-ray and MRI, magnetic resonance imaging, or CT, pacemaker microscopy. Or you can think of artificial organs, such as artificial joints or artificial heart valves. Or even more complicated is whole organ transplantation requires a lot of technologies. Another example as a human genome project you can think of, for that, next generation sequencing machine development. Or for those who have diabetes in their families, one can see usually blood glucose tester. And if you go to a hospital, you can find many syringe needles, which requires engineering to produce. And those who have not a good vision may have contact lenses, which has very high price per mask. Or even these days, many people have smartphone or smartwatches, which can have a heart monitoring system. And these data sets can be useful for digital healthcare. Thus, biomedical engineers invent, design, and build new technologies for diagnosis, treatment, and study of human disease to overcome our diseases. And this ultimate goal of treating or improving our quality of life requires not only a single discipline or single field of knowledge, but it requires multiple disciplines together. So This has been realized by working a team of engineers, scientists, and physicians. So the progress of advances in biomedical engineering, let's think of it throughout the history. So in the ancient period, human beings can make simple machines to improve life. For example, lever, knife, and wheel. And simple machines, we start to be able to study people, for example, scalpel, surgical knife, and stethoscope, which can listen the sound information from the body. And this allows us to understand our human physiology better. And that leads for us to making even more complicated machines to improve our function. For example, splints and sutures to close up a wound or surgical place. And thus, we make more complex machines to study people. And this includes magnetic resonance imaging, electrocardiogram, or even patch clamp, which we can even find a fine electrical signal at the cellular level. And this allows us to understand better our human physiology. So better machines to improve our function. For example, now we have artificial hips or joints, and even we are talking about brain and machine interfaces. So this shows the advancement in biomedical engineering and sequential development of improved tools to study physiology and subsequent increase of understanding physiology that results on improvement of dramatic increase in our human life expectancy and quality of our lives.